Welcome to the Relationships Inside Out podcast with Doctors Gregory Siebert and Kimberly Murray, licensed marriage and family therapists. Join them on this journey as they explore the ins and outs of relationships.
Well, welcome to Relationships Inside Out, where today we're going to talk about the journey of pregnancy.
Pregnancy for some people is a really easy journey, and it's an easy journey to start, to go through, to end. But often that's actually the more unicorn experience.
I think about those parents or the mamas that had an easy one and they go to tell someone that had a tough one, and then just like if you have an easy experience, don't share it. I'm just kidding.
I'm not the one that went through the hard one.
Yeah.
But even getting pregnant, often Hollywood romanticizes it as one time, wham, bam, thank you, ma'am, you're done. And for some couples, like my husband and I, we got pregnant first try every time. Did we stay pregnant every time? No. So then there's that factor. Can we stay pregnant? We had talked about infertility, miscarriage, stillbirth. So many things can happen here.
There's a lot of variability. And I think today we really want to highlight just the journey of pregnancy until birth. And
once you're pregnant,
what's that like? What are some things to look out for, to expect, things like that.
So pregnancy is, as we know, typically around 40 weeks. In the United States, we consider full term at 38. And typically we don't encourage mamas to go past 42 weeks, though if a mama knows, she can actually advocate, if her body is at 42 weeks, she can advocate to stay pregnant as long as she'd like. The risk, of course, is a large baby, gestational diabetes, hypertension, and some different things. But typically that pregnancy is going to end somewhere around that 40-week mark.
And that's a long time. And let's talk about
10 months.
Let's talk about this in the context of relationships and
families. And pregnancies, whether they're expected or unexpected.
Yeah.
That lead up to get there. Have I been trying one time, or have I been trying for 10 years?
Yeah. A lot of that has a significant impact on the journey in terms of your psychological impact, and how you're set up for it or not. I mean, I work with a lot of couples who have been pregnant, and then I've worked with them after. And there's just a lot of topics and things to think about that you wouldn't normally if you didn't go get support or somebody who's like trained in this to set you up. Because there's just little nuances that people who've been through it
you wouldn't even think about.
Wouldn't even think about. Because my wife and I are going about it now, and I do this clinically, but there's a lot of nuances that have come up through this journey.
What are some of those for you, if you don't mind sharing?
Yeah, I mean, I think the biggest one is I don't have to think about being pregnant every day. That's a privilege as the male partner. I don't think about it. My wife, physiologically, she knows every single day, especially the first trimester. And the second trimester, I mean, you're still exhausted. And so I'm learning from her. And I think what we did really well is when we first found out, we set expectations of imbalance and reciprocity.
Bingo.
And that really helped out for me, because I was like, yep, this is how she's feeling. And I just took over everything. And I had the mentality of like, this is going to help her. This is for the long term. There was no resentment. I couldn't imagine where she was at. It was just trying to give her empathy, because as the male partner, I don't have to go through that. And I know that. I get to sit off kind of a little bit and be like, oh, this is fun. And she's like, yeah, no. And on the flip side of that, it's as the male partner or the non-pregnant partner, you're often forgot in this part of the process. They don't actually really ask you if you want to bring your partner at all. They just and they don't even look at you a lot of times when they're discussing things, as if you have an impact or role. And I think that has an impact on me. It's like, well,
I believe it.
I do want to play a role. Like, especially let's think about, for example, one of the things that comes up all the time. Do you want to do genetic testing early on? Right.
And they defer to mom. For all of these decisions, they're going to defer to mom because it impacts her body.
Yeah.
But our hope is that whether it's heterosexual or homosexual couple or whatever, that it's a partnership decision.
Yeah. And granted, she's going to have more power. It is her body. She's got to go through the pain, all that stuff. She's got to be super vulnerable on the hospital bed when, if we were to come
every
to term,
exam, every check,
everything. And so it makes sense. And I think more for the sake of the relationship, it's important to at least have some kind of sense that there's collaboration on it. Some people feel involved, and there is literature coming out now about the male being forgotten, and then this leading to depression. So yeah, I mean, it's very interesting going through it and the little nuanced stuff that you don't think about. So
think about baby showers. Traditionally, it's all women. It's always women, right? There's a big push now, and both of ours were co-ed because it's our baby.
Yeah.
I have been firm with this from the beginning, and I encourage my couples the same of we are pregnant, not I am pregnant. And that language doesn't feel comfortable for some couples, which is fine, or feels invalidating to the woman. So that may not be a good fit. But for us, it acknowledged that my husband is part of this.
Yeah.
Also, like if I'm abstaining from drinking, by and large, he abstained from drinking.
Yeah.
If I can't have certain foods, he's not going to have those foods. Right.
Yeah.
Not that it will do anything to his body, but as solidarity, as a joining of the team part between us, he went to every single baby appointment with both of our girls.
Yeah.
And that inclusion of when I'm booking those appointments as the female partner, what works for his schedule? What would feel comfortable for him? We always put our chairs side by side and picked providers that encouraged that, or encouraged turning to my partner, looking at my partner, drawing him in when they could. I think that's important.
And what you're talking about is the very thing that is the essence of this journey is we can talk to our partners if we have the ability to do so about this process. How do we want to be included? How do you want to manage this? What do you want this to look like to the best of our ability that we're able to? Because some people don't even talk about that. And that's why we're bringing this up today is, do you want to be the inclusion? Do you want to use the language of we? Do you guys agree on genetic testing?
Do you want to do the nursery together?
Do you want to do the nursery? Do you, another one, how do you want to let people know?
Yeah.
Do you want to throw a party they say gender reveal. Shouldn't it be sex reveal?
It's sex reveal, but it sounds gross if you say that.
Okay. Biological reveal. So just all of these little nuances that you don't think about that are important in this process of what role do I want my partner, if that's even a possibility, to play in this, or what role do I want my friends and support system to play in this if I'm by myself?
Think about the evolution of even labor and delivery over time, right? When we think back, even some moms now, but think back 50 years, men, or 100 years, men weren't even in the delivery room. Often they weren't even in the hospital.
Right.
It was women doing their thing with their moms and sisters, and men got cut out. We're making progress. We see this in paternity leave versus maternity leave.
Yeah.
Right. The fact my husband got 4 months of full paid paternity leave is unheard of in this country, which makes me sick in and of itself. And then women have at minimum 12 weeks, which also makes me sick, but whatever.
Yeah.
But the idea of paternity leave is still like new and cutting edge thing. And it shouldn't be, because men go through it, hopefully, just as their partners do. And I'm saying men in a heterosexual context here.
Yeah.
But the non-birthing partner should have the same supports available to them as the birthing partner.
And that's where it's tough. And I think they're getting better at acknowledging the non-birthing parent or partner. And it's hard because going through that, there's acknowledgement of like, yeah, that's tough, but there's no validation that it may not be to the degree of the birthing partner, but there's still some suffering. And I think everybody wants to be validated to that experience. And when it's completely like, oh, you know what? No, just turn your head into the wall. I'm going to focus on the birthing partner. And they should be the importance. They should be the focus. But
there's room for inclusion too. Doesn't have to be either or.
Well, and I think about what that does to the relationship.
Oh yeah.
And the resentment and the tension and where that goes. And the other person, because during this time, the non-birthing partner, depending on where that birthing partner is in terms of whether are they throwing up a lot, where are they at, there's not going to be reciprocity in the relationship during this time. There's not.
And this is what makes me sad. So you're saying like you want to be involved, but there are partnerships where the non-birthing partner does not want to be involved.
Yeah, that's why. Yeah.
And it just crushes my soul that the woman who's giving birth may have to do it alone because her partner doesn't want to be involved or doesn't care to be involved. And when you have mamas who go through morning sickness or fatigue, or like I was hyperemesis, so I threw up 20 some odd times a day.
Yeah.
For almost my entire pregnancy. If I didn't have that supportive partner, I literally don't know how I would have gotten through pregnancy. Right. And there are women who go through that experience, hyperemesis or others, that don't have that support. And it absolutely destroys their mental health and their relationship.
that's crushing. And it's kind of finding, where's that support? Where can we bring in that support? Do I bring in a parent if that's possible? Do I bring in a best friend? Even that, whoever the supporting partner is, acknowledgement of the fact that they're taking on a big load during this time too. It's nowhere near what the birthing partner is going through. It's more of like like, good job. I appreciate what you're doing. This helps out a lot.
My husband had to take over every chore, all of the parenting for almost 40 weeks. I think I had 6 weeks off total with my second. That's a lot on him to essentially single parent, single household run our house. That was a lot.
Yeah.
But also, what is it like for the birthing partner to not just go through it, but to surrender to needing support, to ask for support? Does it mean that I'm insufficient? Does my partner guilt me for it?
Yeah.
Do people judge me for it? Often we hear the phrase, it's just morning sickness.
Oh my goodness.
Like, makes me cringe. It is debilitating for a lot of people that go through it. And thus the stress that gets offloaded to their partner is debilitating.
And it's sad because there's not a right way in this process. And I think we're just bringing topics up that are important. And the one that you're talking about, like the throwing up and debilitating, is what role is that partner going to actually play when that partner's sick? Are we talking about holding hair? Are we talking about cooking food? And then where's the expectation for that reciprocity in that? And when you're talking about throwing up, it brings up the topic of the body's changing for the birthing partner. And there's a lot of sensitivity and insecurities around that come up that people don't think about. And when somebody's pregnant, everyone's just like, oh, let me see your belly. Oh, you're getting a little tubby. Just these things that.
Are you sure you're not carrying twins? Are you sure your due date's right?
Yeah.
Strangers touching your belly. Oh gosh, I could go on for years.
And even as the non-birthing partner, I've made comments and my wife's like, no. And I'm like, oh, like, because my intention is never a malintent, but it's almost socialized. And these little nuances you don't realize as the partner. And you're talking about throwing up, and it's like, I might like say something about that, and she'd be like, no, like, this is whatever might come up for her. I mean, there's these little things that have to be talked about and discussed, and it's so important that there's communication.
Or even like, I remember with our oldest, I was puking through Christmas, and we had family, I won't identify them, who said, like, I did not want to go to said functions because of the smell of food. And they were like, you're going to ruin it? Or,
oh my goodness.
Well, can't you just try? Or, well, we'll just take some extra meds. And you're just like, I'm sorry, what? But everything changes. Your hips change permanently in terms of shape. Your organs quite literally get displaced. So in pregnancy, by your 3rd trimester, your lower gut organs are up where your diaphragm should be. And your diaphragm gets pushed up, so we can't take a deep breath. We can't sleep well. And we cheapen that to, well, women go through this all the time. And these little invalidating comments are killer for both partners, right? Because say it's my mother-in-law, not saying it is, but say it's my mother-in-law.
I have a strong feeling it might be.
Who makes the comments. It's also stressful for my partner, because now is he going to say something? Does he have to get into another burden, another battle?
Yeah.
And that's hard for him.
And oh God, and so during this process, I've learned how much validating my wife is so important, because she beats herself up a little bit about, I need to be doing rest. You need to rest.
When you're used to being productive, to slow down to full tilt, like
that is a very hard, especially that first trimester. It is a stronghold. And that's something that she wasn't used to. So the validation there, or the validation that she's more hungry, right? There's people in a joking way will make comments about, like, oh, that's a lot of, you're so small. That's a big meal.
You're feeding too.
And it's just those little things that are so innocent play a role. And during this journey is talking about, what is that going to look like? And how are we going to navigate these stressors? Because they're going to come at you. You can't control these things.
No.
In the relationship, you can, by talking about it and saying, I need more validation around this. I need you to be more sensitive around this topic, because this is how it makes me feel. Perfect. But when people, in-laws, that come in and make comments, friends, we don't have control. So what does that look like in the relationship?
And hormones. We talk about female hormonal changes, but one, we don't talk about what that actually looks like and does to the body. But two, we don't talk about the fact men's hormones also fluctuate in response to their partners. So particularly after birth, men, as their oxytocin goes up with having a baby and doing skin to skin, their testosterone goes down. We don't talk about that. And what that means for men's postpartum depression. Men, it's 1 in 10 that we measure. It's actually probably higher, but men don't report it as much as women. And I wish we did, because they are going through the same hormonal fluctuations, not the same, but also going through hormonal fluctuations as their female partners. And I wish we talked about it, right? That it is a both and. Both partners go through this, and it can make it so that we are more irritable. Can you give your partner grace, knowing that they're going to be more irritable? That these hormones hijack our psyche. So where I could be reasonable and rational and calm before, my body gets hijacked and I don't have control over it.
Yeah. Or if you were not reasonable or rational before, and then.
Yeah, we don't talk about that part. But the anxiety goes up. Think about it, someone who's already predisposed to anxiety. Okay, 3rd trimester, those bottom side organs are getting pushed up. I can't take a breath past half of my lung. That is a trigger for anxiety for many people. Now I can't breathe.
Yeah.
So now I'm panicking. I can't eat because my stomach is quite literally compressed. My heart rate is going to change because my blood volume is now doubled. Plus my organs are compressed. And we don't think about all the things that these bodies go through in pregnancy.
Yeah.
And we just say, well, she's pregnant. She's just emotional. Just ignore her. And it's incredibly invalidating.
Yeah. And going back to your comment about, oh, women go through this all the time. Yes. And it's fucking miserable.
For the women that go through this all the
time. You specialize in this. You've gone through this as a mother. This is your specialty clinically. Do you mind sharing a little bit about what you work with couples during this part?
It's the whole gamut. So we talk about preparing for baby. So the practicalities, logistics of how do we want to feed? What's our backup plan for feeding? So if I want to breastfeed and then I don't lactate, or I don't produce enough milk, or my milk has high lipase. Okay, what's our next choice? Are we going to use donor milk? Or are we going to do formula? Are we going to supplement? So that, how do we want to sleep? Do we want a bed share, sidecar, pack and play, co-sleep? There's so many options and how to do them safely.
Yeah.
Do we want people there in the delivery room, in the postpartum space? When do we want visitors? Do we want visitors right away? Do we want to wait 6 weeks? Vaccinations, the big decisions that are going to come, preparing for the logistics. That's one piece.
Yeah.
I do a postpartum support plan where I have couples, each of them, because it's important, both partners fill it out, of what are the things I need to do daily to cope once baby's here. So showering, eating a certain number of calories, whatever. Tools for when my mental health is starting to decline. Signs that my mental health is starting to decline. Supportive people I can call, and then crisis services on there. And I have them put on their fridge. So some emotional preparation. We talk about the emotional and logistic preparation of sleep. So how are we going to alternate? If I'm worn out and I'm taking every single night shift and my husband's sleeping like a babe over here, it's not gonna be good for anyone.
Yeah.
We talk about that. We can talk about things like postpartum depression and anxiety, but that is one that you think you can get it, but until you have it, it's really hard to actually conceptualize what that feels like.
Like when you're in the thick of it.
Oh yeah. Right.
Like you can't see the forest.
I can think of what depression looks like.
Yeah.
But when I'm actually in it, it can be a much different experience. We talk about how to include the male partner or the non-birthing partner, all kinds of things.
Yeah.
The involvement of in-laws is a huge one, right?
And to what extent?
To what extent? Who's visiting first?
Yeah.
All the things. In terms of the birthing and postpartum space, I'll be honest, my bias is to defer to the birthing partner. Yes, I want the non-birthing partner's input, but especially like labor, delivery, and the first few days after, her body is on display in full nudity and she's bleeding from places she wasn't before. Her belly has gone from firm to soft and she may not feel good. She had a C-section. She had a major surgery.
Yeah.
If she's having trouble breastfeeding, if she had a tear, anything, it is incredibly painful. It's incredibly vulnerable. And often we feel like having a visitor puts us on a stage. That doesn't feel good.
Yeah. So it's good that I deferred to you in this because
sorry, I can go on for years because we don't always talk about it besides the practicalities or those minimizing statements of it happens all the time.
Yeah, the very like tangible stuff that is logistical. And I think that turns off a lot of people from having kids, the tangible stuff, because there's a lot of experiential stuff that both need to be can't be understood unless you're going through it in a negative way, but also a positive way.
Oh, the blessings are immeasurable, indescribable. Yeah. The love I feel for my children is not a love I've ever tapped before, even with my husband, right? Yeah. They're different. And the love I have from my second to my first is different. And seeing them as a sibling pair, it's different. So it's the most difficult thing a couple can go through besides the death of a child. It is the single largest predictor of marital decline in satisfaction and quality, again, besides the death of a child. And no couple's immune. I know that there are people listening that are probably saying like, oh, that wouldn't happen to me. It will. Like, I'm just going to blanket that. But we can prepare, whether it is reading or talking to other parents or really boosting our marriage as much as possible before that hit happens.
Yeah.
We started at 10 instead of a 4. We have a lot more room to decline than if we're already starting out in a pretty shitty place.
And you brought up a lot of important topics to go over with the couples, to think about the nuances. And I know you do this as well. And an important part of this is getting them to communicate effectively about this.
Oh, yeah. And in general.
In general, yeah.
How do we build trust, communication, love and affection, reciprocity, aside from baby? It can't just be about baby.
And navigate where our values don't line up. I think about couples, like, for example, this one couple that they don't agree on genetic testing and finding out
such a tough one.
Sex of the baby before birth. The non-birthing partner lost out on this, which, I think for society is like, yeah, that makes sense. That person's still feeling something. They're
feeling a loss of autonomy in this.
They had expectations of what this wanted to look like for them, and they're not able to do that now because their partner doesn't share those values. And so navigating that in a communicative way, an emotional way, how do they navigate that stress in general? And, this is, if I think about it in the context of what we train couples to do in general, is navigate stress. This is one stress, probably one of the biggest stressors in a couple's life, if this is something that they choose and it's a journey that they are on.
Is baby going to be baptized? If we find out that the genetic testing does show an abnormality, what are we going to do about it?
Yeah.
Are we going to continue with pregnancy? Are we not? Are we going to do further testing? Are we going to do intervention? How does that align with my religion, my culture, my family? It is so complicated. And I hear couples at times say, a baby will bring us closer together, or a baby will fix this. It won't. Like, unequivocally, it won't. And so can we, even before we get pregnant, can we talk through those values and all the things I just listed? I'd much prefer to talk about before you're pregnant.
And the hormones might make you feel good for a little bit, and expecting, and it might seem like things are good. And I think about the ones that are having an additional child, or having another child, is it's not going to be any different than the struggles you had before you got pregnant again. Like, it's tough.
Or I'm going to do the exact same thing as a parent with the second one. I said that. I'll totally own that, of like, no, what I did with Harper will be the same with Skylar.
Kids are different. Yeah.
And I was like, no, they're going to be the same personality because I made Harper just this angel. Do I ever have egg on my face? Because they could not be more different.
Yeah. Temperament's different. So the how they learn is different. How they respond emotionally is different. How sensitive they are to different things.
How we bond.
Different. How they bond and what their needs are. I mean, I think about it in like a relationship. How are they validated? How do they feel loved? Could be completely different. How they show it is different. And I see parents where they have this expectation that the way the children's going to show love is the same. And as they grow up, it changes. And it may not be the language that works for you.
My hope is that we'll do a postpartum specific episode, because there's so much that also impacts there that's different than pregnancy, including that bonding piece and how we each bond differently.
Yeah.
Remember, bonding starts in vitro. Trauma starts in vitro. We think about trauma as only an external experience or something that we go through when we're older. But what we know is there is in utero trauma. So if a mother goes through car accident, domestic violence, her own stressful events, that impacts the development of babe.
Yeah.
And how do we talk about that as a couple? For bonding, how do we bond my husband or my non-birthing partner to babe? So my husband sang to my belly all the time, or would speak to my belly, or play certain songs. I encourage those things anytime a couple can do it, because then babe doesn't just know my voice. babe now knows his voice, right?
Yeah.
I encourage kangaroo care, that skin to skin. Mom first, if we can. Not always is that an option. For an hour, and then we go to dad.
Mm-hmm.
It's important that bonding happens with both partners.
Yeah, that'd be great. We'll have another episode on the postpartum specific.
Yeah.
Is there anything in this journey else or in the journey of being pregnant that you can think of?
Get curious. What my pregnant body might need is going to be different than what person on the street's pregnant body might need. As the non-birthing partner, ask what she needs. Try to anticipate her needs. Like, you anticipated your wife would need new shoes. Fantastic, right? Thinking about, in terms of nutrition, thinking about.
If she's craving something, I'm in the car and I'm going to get it.
Yeah, you are.
And I actually love that. And she laughs. I love going out to get her food because she doesn't normally eat out. I'm like, oh, we're getting food because that means I get some. Hence where dad bods get created. Go ahead.
But really trying to get curious with one another. If my partner doesn't feel connected, hey, hon, what's going on for you? How can I help bring you into this space? Right? Is it holding the belly? Is it buying an outfit for babe? Are we going to play in the nursery together? Pregnancy is a short but also long experience. And it's incredibly intense, right? We have to make a million decisions. The decision fatigue, it's a real thing. So if I'm capped out on decisions, can I just, can I turn to my partner and defer to him to make decisions? And that's important. It helps him feel involved, feel important in that space. And it gives me relief, and vice versa.
And if you are okay with this, what about mothers or, that don't have a partner?
Oh, breaks my soul.
What about the support system? Like, what do they bring in? How do they prepare for this?
Yeah. Find other support persons if you have them around you. That might include a doula if you can afford it. There are pregnancy doulas, birthing doulas, and postpartum doulas, as well as bereavement doulas. Include them, include parents, friends, whoever feels safe for you. I encourage getting support wherever you need to get it. Don't try to take pregnancy by yourself, right? Pregnancy is an animal. It is hard, and what was challenging for me and my body is going to look different than what will be challenging for your wife, right?
Yeah.
I had indigestion the whole time. There are women who don't have a dot of it. Pubic symphysis pain. If you've had it, you know exactly what I'm talking about. It hurts. I never had it, but my best friend has it all the time, right? These really cute terms. Lightning crotch.
Yep.
That's a thing.
Yep.
And how do we adjust for that? Right? Pregnancy is so complicated. There's no simple way to talk about it because it's different for everyone. One thing I do want to say, in terms of pregnancy, labor, and delivery, this is my soapbox. I recognize that. But know that any and every medical decision that is made to the birthing partner's body has to be consented to. I hear people say, well, the hospital made me have a cervical check, made me do genetic testing, get a C-section. They can't make you do anything. I want to be really clear about that. So if you're pregnant or thinking about getting pregnant, your medical autonomy is so important in this process. Know your rights as a medical consumer. Sorry, soapbox end.
Yeah, no, that's good. I think it's very informative. I mean, this is your specialty. You've been a mother, or you are a mother, not been.
That's just something I need to know.
Yeah. The other ad I want to add to like the support group stuff is for the non-birthing partner.
Yeah.
There are support groups. They're few and far between. And I think there needs to be more.
We're growing a little bit.
There's just, So there are support groups out there to go out there for, if you feel isolated and you don't know how to deal with this frustration that you don't feel like you have autonomy in this process or even in a role in this, or maybe you're feeling kind of down for whatever reason in this process, don't know what to expect, or you feel your quality life. Go to support groups where there's other like partners or parents that are experiencing the same thing.
Go to the birthing classes together. In terms of the groups, 2 great resources are going to be your local hospital. In Northern Colorado, all of our local hospitals have dads groups. Another one is one called Postpartum Support International. I'm certified with them. They're the largest perinatal, which is anytime from conception to 2 years after birth. They're the largest perinatal mental health network in the world. And they have support groups listed that are both in person and virtual for non-birthing partners, fathers, mothers, siblings, kids, you name it, they've got it. For also during pregnancy. This is not just for postpartum. But go on there. Their website has them, and often they're free.
Yeah, those are good resources. Another thing that comes up, and I jump all over the place, just in my brain.
That's pregnancy.
And then I lost it because that's my brain.
You must be becoming a parent. You can't remember anything ever.
I'm glad you said that. So thinking about this process of pregnancy, if you already have a child, and you've kind of alluded to this, is who's parenting while this is all happening.
It's a different animal when you have another one. And we had a bigger gap by American standards. We had a 3.5-year gap. I super recommend it, by the way. In fact, the body takes at least 3 years for the uterus to completely heal, as well as your adrenals. So literature actually supports at least a 3-year gap. I digress. Yes. How do we parent a toddler, especially if mama's really sick? How do we include? So I don't know if you remember. I don't know if you were here yet, actually. Instead of a baby shower for our second babe, we had a big sister party. Because often the sibling gets kind of forgotten about when there's this new precious baby.
Yeah.
So in lieu of a baby shower, people still brought diapers, but we did a big sister party and people brought gifts for Harper. So an apron so she could carry Binks and socks, or fun outings for just Harper. But we had balloons that said Big Sister, and she had a shirt, and it was all about celebrating her transition in role 2. We cannot forget that in pregnancy, it's not just mom and dad that are transitioning.
Yeah.
Our parents transitioned into grandparents. Our kiddo transitioned into being a sibling. There's a lot of role changes. And so we did that. And I really encourage that.
That's awesome. That's a good idea. And you actually said something that brings up is the non-birthing partner, if they're the same sex, they're just as important in this process.
Oh, 100%.
Right. They're very important in this process. And a lot of people are like, well, no, you may not be the biological, right? Maybe they weren't able to have a biological. And it's
fills
like,
my soul.
Nope, this is the person that's going to play an important role. They are very much need to be included in this process.
One I will briefly touch on, but it, again, is such a nuanced thing that it's going to be very brief, is surrogacy. For women who can't or don't want to carry a baby within their own womb, we often, or for like hetero or homosexual couples, will use a surrogate. So someone else is carrying your baby. It is important that you're included in that journey just the same. So you're going to those pregnancy appointments with that surrogate. Both partners are going. That you are there for the birth, that you're included in baby showers just the same.
Yeah.
I really want to highlight that, because surrogacy is something that couples who are, often it's a privileged thing because it's so expensive, but who go through it and we don't talk about it because it's a rare experience.
Yeah. No, it's a really good point.
Happens.
It's a really good point. And it makes me bring the question to you is, what about people who are okay with not being involved and a couple have agreed upon that one partner doesn't have to be involved to that extent?
If that is the way both of you feel, and it's a mutually agreed upon experience, cool.
Yeah.
What gets really tricky is when one partner wants the other one involved and they say no.
Yep.
That's a different animal, because that creates resentment or can create distance. And go back to what I said about working with couples who are pregnant or planning to get pregnant. If we've already got resentment on board and then we have a baby, that relationship is not heading in a great direction.
And that's where I typically work with that one partner and wonder what is coming up for them that they don't want to be involved. Is there any specific things? Is it cultural? Is it what's happening? Because sometimes it's been cultural where that's just not something that's expected in their culture, and that's the role of the wife in that case. So it's very interesting to think about these dynamics from a clinical perspective, because we have to be open to all the different beliefs and values around this. And I think there are some people who don't want to be, and if that's not typical, I might be curious is there anxiety? Is there previous trauma around this? Is there any fears that we don't know about that we want to uncover? Things like that.
And you mentioned something that just triggered a thought in my brain: birth trauma. Birth trauma is prevalent in American culture. We have one of the highest C-section rates of any first or second world country in the world. And we also have one of the highest rates of infant and maternal mortality rates in the world. So our babies and mamas die at a higher rate than just about any other first world country.
Wow.
And second world country. Because we really push medical intervention and things like this. We got to talk about that piece. We have to talk about trauma and how this pressure goes. When I mention medical autonomy, often it's to prevent that exact thing, trauma. But if you have, so for my first, I had major medical trauma and birth trauma. Literally didn't know if I was going to survive it. Neither did my husband. And it was horrific. And then I lived in Florida at the time. Because I consented to a male physician, they decided to, as a medical system, invite in every medical male intern that was in the building to come and witness my birth. So when I say I had probably 20 men staring at my crotch, I'm not kidding. It was terrible.
Oh my goodness.
So I had to do the work, and that can also be part of what I'm working with couples with. How do we process through that trauma so you don't bring it into this next birth?
Yeah.
For both partners.
Yeah.
Chances are if I went through trauma, so did my partner.
Yeah.
Right?
Yeah, good point.
So talking about that, treating it as two very different births, two different babies, maybe changing up our medical team. That's an important thing we talk about too. And a huge part of my practice is processing birth trauma and how to advocate, how to feel autonomous, strong, and confident in our bodies, how to help partners advocate, the things.
And how do you prepare couples that are in the pregnancy phase for this?
Yeah. And going through it again.
Talk about the expectation. Yeah. Even for the first time parents, potentially, right? Is the expectation that this is a possibility. And
say hemorrhaging.
Yeah.
Hemorrhaging is something, if you've been through it once, you're slightly more elevated the next time. So it may happen again. I can't get rid of that. Like there's no way to mitigate that.
Yeah.
There are factors that can help reduce it. But how do we plan for if it happens again? What are we going to do?
Yeah.
Right. What does that support team look like? Birth trauma is huge. I don't know why I didn't think of that sooner.
Yeah. Very important.
And important for families and loved ones. As you're sharing about pregnancy, postpartum, be realistic. Like people need to have a realistic idea of what this could look like.
You mean not Disney? Go ahead.
Not Disney, not Hollywood, but also don't be cruel, right? If I see a mom is really nervous about birth, I'm not gonna be like, let me tell you how terrible mine was. It happens all the time.
Yeah.
All the time. Encourage women, encourage them to feel strong, to make the choice that feels best for them. In pregnancy, you're going to get 1,001 opinions of what is best. You don't have to take any of them. You get to choose for your baby, for your body, what's best for you, for your partnership. Not what's best for Susie Q, not what worked for your mother, none of that shit. What's best for you.
Well, I don't know why they're having issues. I never did.
This is, you go on these mom groups, Greg, and it is like, holy Nelly.
Yeah. That's almost a niche in therapy in itself, is working people from trauma from the mom's groups.
If you breastfeed you wrong, if you bottle feed you wrong, if you co-sleep, sidecar, anything, cloth diapers, not cloth diaper, it doesn't matter.
Yeah.
You're wrong. So just know that you're going to be wrong 100% of the time.
Yeah. When I'm working with parents, that this is something that comes up a lot is a lot of the guilt and shame that come from the mom groups. And it's like, what? Like, this is a place for support. Why is there so much judgment? And
moms are the worst. And I mean that full-heartedly. They're the worst. Other moms to moms,
not supportive.
They're cruel because my way is the best way. And I'm going to prove it. Because
if it's not, then that means I didn't do something wrong and I can't handle that dissonance. And that's something we talked about in our previous episodes, distress tolerance.
Yes. And I wish that there was more support and love. So if you're on those groups and you find that they're bringing your mental health down, get off the groups. Go find an actual support system.
Good point.
Get off the groups. You don't need the extra stressors. If your mom or mother-in-law are chirping in your ear, block their phone calls. You don't have to do it because they said you have to do it.
And same for non-birthing partners. If you go into a support group and you feel like they're telling you what you should do, I use air quotes there, probably not the best.
Or they're bashing their birthing partners and that feels uncomfortable for you.
Yeah.
Step out.
Yeah.
Right? You have to be your biggest advocate. Both partners have to be your biggest advocate because no one else is going to advocate for you more in this process than you.
Yeah. And the non-birthing partner, you can ask for stuff from the birthing partner. It's got to be some understanding that it may not come in the way or how or when, but you still have that privilege, or that right, I should say, in this context.
And have that right from your care providers. If the non-birthing partner's in the room and they don't understand something, speak up, ask.
Yeah.
If you know your birthing partner, the one who is going to give birth, is afraid to ask a question, ask a question for her. Because these questions are so important.
Yeah. Even if the culture is pushing you away because you're not the one giving birth, you have a right to ask questions and a right to know, especially if you're going to be part of this. Very, very much so. And it's okay to ask for needs from your partner within reason, of course.
Our nurse and doctor that we worked with for ours knew Chris just as much as they knew me.
Yeah, that's great.
And that was important for me. Do we have to work for that sometimes? Yeah, we did.
But you advocated for yourselves, yeah.
But it was so important to us as a team. You have to advocate. Pregnancy is so hard. For those that are in the back, I'm going to say it again. It is so hard. It is unlike any other experience you will go through. There are privileges to the birthing partner. She gets to feel movement. The non-birthing partner never gets to feel that within their womb. She gets extra attention that non-birthing partner is not going to get.
Until after the baby's born.
After the baby's born, we see a total reversal. It goes baby, then the typically male partner.
Yeah.
And then mom.
I can't wait for that. Thank you.
Because if a man changes the diaper, oh my God,
he saved the world. He saved the world. He changed the diaper.
Such a good dad.
It's just expected of the moms, and the dad changes one diaper, and it's like, he's father of the year.
You see those? I don't know if
you've
ever seen it. It's like commercials or memes where it's like these moms fanning themselves of like, do you see that involved dad? You never, ever see men fanning themselves saying like, look at that involved mother. No, because if I'm not involved, I'm a terrible mother.
Yeah.
But dad's not involved. Oh, he's a dude.
Yeah. For women, it's like, this is expected. And if you're not hitting there, you're not good enough. You're failing. Dad, it's like, we expect you to do nothing. And when you do something,
oh my God,
you're a god. Yeah.
You're so great. I can't. And so once we give birth, moms go from all this attention and love in pregnancy to forgotten about, to be quite frank.
Yeah. I will say that there's it's not that black and white, especially with the father in particular. There's also the absent father. Your husband doesn't do shit. Doesn't do shit with the kids. You're doing everything. So there is that piece of it too.
But it makes me want to barf when I see it.
Yeah.
And it happens all the freaking time. But preparing the women for that too. You're going to have a lot of people dote on you for a good chunk of time. Once you give birth and that baby is something they can hold, they're not checking in on how your crotch is healing or your belly is healing or how's breastfeeding going. And in fact, we actually ostracize women in that space of, you can't dare show your boobs, but I expect you to feed this baby every 2 hours, but don't show me your nipple.
Yeah.
I'm an open breastfeeder if no one can gather. But talking about that, preparing for how the non-birthing partner is going to keep mom involved after birth, right? I would want to hide with Harper in my nursery. And Chris saw how much that impacted my mental health, that every 2 hours I was having to go sit by myself where everyone else kept chatting or doing what they're doing. And so with Skylar, nope. He made sure I breastfed right where I was sitting. And it was really encouraged and supportive in that way.
That's awesome.
Oh, one tip too, once you give birth, I think I mentioned this in a previous episode. Sorry, Chris, I'm going to throw you under the bus. Please, for the love of all that is holy, men, do not moo at your partners. My husband walked by as I was nursing and mooed at me like a cow. Don't do it. It's not funny. And I've shared this with other women and their partners have done the same.
Oh,
Greg, don't do it. Huh. It's a farce. You don't want to do it.
That never came to my mind, but I don't know.
Now it did. So don't do it.
Yeah. Wow.
But be sensitive of your partner, right? Pregnancy is tough. If you need support, there are so many support systems around you. Reach out to them. Go to them. If you need help, especially if you're in Northern Colorado, reach out. I'm happy to help. It's my jam. Well, this has been Relationships Inside Out, where today we talked about pregnancy and postpartum and a little bit of postpartum and how nuanced and challenging that journey can be.
Yeah.
As always, if anyone has any questions, concerns, or topic suggestions, feel free to shoot us an email at relationshipsinsideout@gmail.com. And as always, if you like our podcast, feel free to subscribe. You can share or post a comment. Thanks.
Thank you.